PARSIFAL was probably the largest non-pivotal study combining a CDK4/6 inhibitor with different endocrine therapies. In fact, PARSIFAL, the objective was to look for the optimal companion for Palbociclib. The study closed at the time that we reached the PFS, and the trial was negative in order to provide a superiority or non-inferiority for Fulvestrant. What we did is we did an extension of the study somehow to capture the survival and also trying to look for prognostic and predictive factors. So we were able to collect information from all patients included in almost 80% of centers by a new study. And the findings are that with a median follow-up of close to 5 years, there were absolutely no differences in behavior in between the two arms. Palbo-letrozole and Fulvestrant-letrozole, Fulvestrant-palbo and letrozole-palbo did exactly equal. In terms of PFS, the hazard ratio is 1.00. For overall survival, it was 0.94. So that allowed us to combine both arms. And for the global population, the median progression-free survival is around 33 months. And the median overall survival is 65 months. So that's very in line with what has been published for other studies, pivotal studies with Ribo and Abema. But it's slightly different from the data from Paloma 2. For me, the most interesting finding is that we wanted to look at prognostic factors. And we, particularly to the duration of response or duration of treatment in relation to overall survival. And something that is quite interesting is that 12 months PFS appears to be a very strong prognostic factor. Other studies, Emerald, have shown that it is a good predictive factor for identifying sensitive patients for endocrine therapy. In this study, what we closed the circle to say that 12 months could be a very useful clinical tool to identify patients that have a much better behavior, but the ones that progress very quickly within the first 12 months, independently of it's in the first 6 or in between 6 and 12, those patients will do very bad. So it's not that they are endocrine resistant, but the chances to benefit from these kind of approaches probably are very modest, and we have to think about going for more aggressive treatments, more appropriate treatments for those patients.